A stroke occurs when blood flow to the brain is interrupted, either by a blockage, ischemic stroke, or bleeding, hemorrhagic stroke. This disruption deprives brain cells of oxygen, causing them to die rapidly. The effects of a stroke can range from minor disabilities to life-threatening conditions, making it crucial to act quickly. According to the CDC, nearly 800,000 Americans experience a stroke each year, one every 40 seconds. Sadly, about 150,000 people die annually from stroke-related complications, making it the fifth leading cause of death in the United States. Many survivors face significant challenges, such as speech difficulties, mobility issues, and long-term disability. Recognizing the early warning signs can save lives, as stroke treatments are most effective when administered within the first few hours. Today, we'll uncover 10 scientifically backed signs of an impending stroke that you should never ignore. Are you ready? Number 10. Sudden numbness or weakness in the face, arm, or leg. One of the most common and alarming signs of an impending stroke is sudden numbness or weakness, especially on one side of the body. This symptom occurs when a stroke disrupts the blood supply to the brain areas responsible for muscle movement and sensation. A 2022 study in Stroke Journal found that 72% of stroke patients experience this symptom in the hours leading up to the event. It often manifests as drooping on one side of the face, making it hard to smile evenly or lift both arms. In some cases, the affected limb may feel heavy or unresponsive, creating challenges in performing simple tasks. If you notice this in yourself or someone else, treat it as a medical emergency. Immediate intervention can prevent further brain damage and save lives. Number 9. Confusion or difficulty understanding speech. When a stroke affects the brain's language centers, it can cause sudden confusion, trouble understanding speech, or difficulty forming coherent sentences. This symptom often appears abruptly and can escalate quickly. A 2023 study in Neurology Today revealed that 30% of stroke patients experienced impaired comprehension or slurred speech before their stroke. This might include difficulty following a conversation or responding appropriately to questions. Some patients describe feeling as though their words are stuck or jumbled, which can be frightening and frustrating. If someone is struggling to understand simple instructions or appears unusually confused, don't hesitate. Seek emergency care immediately. Number 8. Sudden vision problems. Blurred vision, double vision, or even temporary vision loss in one or both eyes can signal an impending stroke. Strokes that affect the occipital lobe or optic nerve can disrupt the brain's ability to process visual information. A 2022 study in Ophthalmology Advances found that 20% of stroke patients reported vision changes before their stroke. These changes are often painless and might include difficulty focusing, blind spots, or the sensation of a gray shadow moving across the field of vision. Even if the vision problem seems minor or temporary, it should be taken seriously. Early intervention can prevent permanent damage and larger neurological complications. Number 7. Severe headache with no known cause. A sudden, intense headache, often described as the worst headache of one's life, can indicate a hemorrhagic stroke caused by bleeding in the brain. These headaches are often abrupt and accompanied by other symptoms such as nausea, vomiting, or sensitivity to light. A 2023 review in the Journal of Neurological Disorders reported that 15% of hemorrhagic stroke patients experience this type of headache. Unlike migraines, these headaches come on without warning and are often described as a thunderclap headache due to their intensity. If you or someone else experiences a severe headache with no known cause, act immediately. Don't wait to see if the pain subsides. Call emergency services right away. Number 6. Sudden trouble walking or loss of balance. Dizziness, difficulty walking, or an abrupt loss of balance can occur when a stroke affects the cerebellum, the part of the brain responsible for coordination and equilibrium. This can lead to stumbling, falls, or an inability to stay upright. A study in Stroke Research and Treatment, 2023, revealed that 40% of seniors who experienced a stroke reported sudden balance issues beforehand. This symptom may be dismissed as clumsiness or fatigue, delaying necessary treatment. If you notice someone struggling to stand or walk steadily, treat it as an emergency. Acting quickly could prevent a life-altering outcome. Number 5. Transient ischemic attack, TIA. A transient ischemic attack, TIA, or mini-stroke, occurs when blood flow to the brain is temporarily blocked. Symptoms of a TIA often resolve within minutes or hours, but it's a critical warning sign of a major stroke. A 2022 study in The Lancet Neurology found that 15% of stroke patients experienced a TIA shortly before their stroke. Common symptoms include sudden weakness, numbness, or difficulty speaking. While these symptoms may disappear quickly, they should never be ignored. If you or someone you know experiences a TIA, seek medical attention immediately. Early treatment can significantly reduce the risk of a full-blown stroke. Number 4. Unexplained fatigue or mental fog. Unusual tiredness or difficulty concentrating can indicate reduced blood flow to the brain, a common precursor to a stroke. This symptom may appear gradually or suddenly and is often accompanied by other warning signs. A 2023 study in Brain and Cognition found that 20% of stroke patients reported persistent fatigue or mental fog in the days before their stroke. Patients often describe feeling as though their mind is cloudy, making it difficult to complete everyday tasks or follow conversations. If you feel unusually fatigued or mentally foggy without explanation, consider it a potential red flag. Number 3. Difficulty swallowing. Strokes affecting the brainstem can impair the muscles responsible for swallowing, a condition known as dysphagia. This may manifest as choking, coughing, or trouble eating or drinking. A 2022 study in Dysphagia Journal found that 25% of stroke patients experience swallowing difficulties before their stroke. Dysphagia often occurs with other symptoms, such as slurred speech or facial weakness, making it easier to recognize. Difficulty swallowing can lead to further complications such as aspiration pneumonia, making it crucial to seek immediate medical care. Number 2. Sudden nausea or vomiting. While nausea and vomiting are typically associated with digestive issues, they can also signal a stroke, particularly one affecting the brainstem. This symptom often appears suddenly and with no clear cause. A 2023 study in Neurological Disorders Today found that 10% of stroke patients reported nausea or vomiting as an early symptom. When paired with dizziness or a severe headache, this is a red flag for a neurological emergency. Take unexplained nausea or vomiting seriously, especially if it's accompanied by other stroke symptoms. Number 1. Drooping face or uneven smile. Facial drooping, where one side of the face appears slack or uneven, is one of the most recognizable signs of a stroke. This occurs when impaired blood flow affects the muscles controlling facial movement. A 2022 study in Neurology Today revealed that 80% of stroke patients experienced facial drooping before their stroke. This symptom is often paired with arm weakness or slurred speech, forming the basis of the FAST acronym. If you notice facial drooping in yourself or someone else, call emergency services immediately. Time is critical when treating strokes. And there you have it. Recognizing these 10 alarming signs could save your life or the life of someone you love. Strokes don't wait, and neither should you. Next, check out this video right here. I think you will love it. Thanks for watching Healthy End, and we will see you there.